So it's 9:01. I'll start and then we'll let others join in. Good morning, everybody. I just want to thank you once again for tuning into Downtown Download. I am Downtown Partnerships President Shalonda Stokes, joined as always by my co-host, Councilman Eric Costello. And we do have a Power Pack show for you today. Just want to set it up a little bit just to know that right now across the globe, as you know, there are some incredibly smart and some dedicated people asking the same questions. We're all living the same thing together. And that's what's the best way to respond to COVID-19? This pandemic is impacting all of us in different ways. And this is all while trying to balance public health and economic recovery. So, you know, in Baltimore, as things were starting to reopen and all across things were starting to reopen, we saw that many places started to see spikes, and including Baltimore City, we knew that that was a trend that we needed to start to subside. Councilman Costello and I are thankful for Dr. Letitia DeRaza. You know that she's concerned about it. She's been balancing all of the questions, comments, everything coming in from not only the business community, but the health community. And we thank her for, and thank you for, Dr. DeRaza, your time today and taking time to spend with us to really talk to our audience about the impacts and what we can do moving forward. Just to give a little background on Dr. D, if you don't know her, she's a Hopkins-trained pediatrician who became the health commissioner in March of 2019. Her special interests include obesity management and prevention, trauma-informed care in children and adolescents, and expanded use of technology to improve health outcomes. She previously worked at downtown-based Fearless Solutions, where she led the team that provided clinical subject matter expertise to the healthcare professionals. I'm interested to see how her past professional experiences have informed her approach to the health department's COVID response. What's interesting about her ascension, and I liken it to what's happening with me as the new president of Downtown Partnership, is when you step into a new role and it's not the norm. And you know, COVID happened during her tenure, and I came in. We have the social justice movement, so there's a lot that's happening, which challenges what a normal leadership environment would be. And so, really excited to talk about that. So, we'll talk to Dr. DeRaza in just a minute. First, I just want to let you know a little bit of what's happening in downtown Baltimore. You know, our special outdoor parklets are on Charles Street. Hopefully you saw them. Last week, we moved it to Mick O'Shea's. So please stop by. It's outdoor dining. It's expanded seating for social distancing. We're also working on Charles Street closure and other design changes to help create safe outdoor spaces. So we're making sure that we keep things safe, socially distant, and in small crowds. So stay tuned for information about our Art with a Heart program and design for distancing changes that are planned in the Bromo Arts District. I do want to remind everyone that the National Aquarium has reopened on a limited basis with reduced capacity. You can plan your visit on their website at aqua.org. And while not open, many of our downtown museums and attractions have virtual exhibits and interactive online programming. So please take a look. Finally, I want to thank everybody who supported the downtown businesses in the past few weeks. I know our shops and our retailers deeply appreciate your business. For those places that still can't open, such as live performance venues, many are holding online fundraising campaigns so that they can still be here when COVID restrictions are lifted. So I encourage you to seek out your favorite venues and see if there's a way that you can help them support, no matter how small. So please, I want to let everybody know, remind you about our format today. Councilman Costello, I'll transfer it to him. He'll let you know some things that are happening in the city. He will also then have a discussion with Dr. DeRaza, followed by Q&A that I'll ask based on your questions. So please remember to put your questions in the Q&A box at the bottom. And as soon as we get finished with the discussion, we'll come back to you. So thanks everybody for tuning in. Councilman Costello, I'm sending it over to you.
Thanks, Shalonda. Couple quick city updates. One, Lexington Market is now accepting applications from vendors. So I've posted the website in the chat function. Would encourage everyone to check that out, and please share that with your respective constituencies. I know the development team at Seawall is very excited about that project and is looking not only to get applications from a diverse set of vendors offering up a number of different things in the market, but also is really looking forward to your input on what our new Lexington market should look like. One other item, we continue to have pretty serious issues with USPS delivery. As most of you know, this is a federal agency. I've been in constant contact with Senator Van Hollen's office on this issue. I would encourage everyone who's had USPS delivery issues to please reach out to the two senators and your respective Congress member. I've included contact information links for each of those folks below. That's all I've got for city updates this week. And I think, Shalonda, we're ready to get into some questions, right?
Yes, let's get into the questions.
All right. So Dr. D, Dr. Zaraza, I call you Dr. D. For everyone who doesn't know you, thank you so much for being here. We know how incredibly busy you are. We're very appreciative for your time today.
Well, I appreciate you guys having me and really excited to answer questions.
That's great. Doc, can we start off? Can you just give us an update on the most recent orders related to indoor dining capacity?
Sure. So specifically, the most recent order related to indoor dining capacity, and I'll maybe even back up to the first order. So on July 24th, Mayor Young issued an executive order that restricted all indoor dining because we were seeing a significant rise in the number of cases. And at that point, we were about a month into opening, and we know that we had cases that were linked to indoor dining. On August 7th, he issued another executive order that specifically allowed for indoor dining to resume at 25% capacity.
Thanks, Doc. And a few weeks ago, you had reported what you called an alarming increase in Baltimore's number of infections. Can you tell us where we now stand as a city? What are some of the key indicators you and Mayor Young are looking at when deciding to make changes in our reopening rate as well as our capacities?
Sure. So we look at a few things. Now, back in May, we established a COVID dashboard that is accessible to the public and can be found at coronavirus.baltimorecity.gov. And if you go to our website, you can actually see the reopening indicators that we're looking at. So we're looking at the number of new cases, and we want to see a decline in those numbers. We're also looking at the number of deaths, again, wanting to see a decline over a sustained period of time. We're looking at positivity rate. So that's the percentage of people testing positive over the total number of individuals tested. We're looking at the number of tests that are being performed in the city for city residents specifically, as well as hospital utilization, because we want to be monitoring to make sure that our hospitals aren't experiencing, surge that they're not able to keep up with from a staffing or bed perspective. So we look at those things as a whole. And I would say that, at a city level, the city leadership also takes into account other data points. So certainly thinking through the economic impacts of continued restrictions. But again, going back to our dashboard and the health indicators, we look to see improvement in all of those metrics, but recognize that we may not see improvement in every single metric, and we may not necessarily see decline in every single metric. But if there's other data we're getting from our contact tracers that is concerning, then I do make recommendations for additional measures to be put in place, or public health interventions to be put in place to try to slow transmission. In our case, at that time, we had hit a peak of over 150, averaging over 150 new cases per day, which exceeded the peak that we had in May at 124 cases. So it was concerning to me that a little over a month after reopening, we had seen such a stark increase. When we actually went to reopen, we were averaging around 60 to 70 new cases a day. So we had, effectively doubled, what we were seeing. And we wanted to, again, put measures in place to keep people safe, to try to reduce transmission of disease.
Thanks, Doc. As you know, and I think most of our audience knows, downtown Baltimore and the surrounding neighborhoods are home to world-class medical, biomedical, and public health institutions. including the University of Maryland Medical System and Mercy Medical Center, which are both in the Central Business District, as well as Johns Hopkins Medical Institutions. Can you talk about how your department is working with these institutions as well as utilizing their resources throughout the pandemic?
Yeah, so early on, the city actually established a public-private partnership with Johns Hopkins, with the University of Maryland, and with Care First. We've subsequently had other healthcare partners that have been involved, including LifeBridge. But again, early on, we recognized that this was going to have to be a citywide effort. If we really wanted to more effectively address the impacts of the pandemic. And so at the end of March, we established this partnership. And within this partnership, we had a few different work streams that addressed certain elements of our response. So for instance, testing was one of those. And early on, LifeBridge was a partner at Pimlico. So Pimlico was the very first city-supported testing site in partnership with LifeBridge, and patients were referred using a call center set up by Care First. And so again, this was an example of all of us coming together and figuring out how we can provide additional testing support to residents in the city. That site has subsequently now morphed into a high throughput site. And we're testing there twice a week, Tuesdays and Thursdays. We started off in April, we were testing about 120 folks a day. We're now able to test about 500 folks a day during testing sessions. Another example is our mobile testing efforts. So the city began supporting mobile testing in May. We recognized that residents needed access to low barrier testing. Residents, especially who might not have access to healthcare, who might not have a car and couldn't drive up to a testing location. And we focused on neighborhoods that we knew were much more heavily impacted based on the data that we had at the time. And we're still very involved in mobile testing. And with our mobile testing efforts, again, we work with those institutions. So University of Maryland also does mobile testing. Hopkins supports mobile testing in 21224. And we work with community-based organizations that are trusted within the community and can help to bring, again, residents who might not have access to healthcare to our testing sites for on-the-spot, first-come, first-served testing. And again, for any information regarding access to testing, all of this can be found on our website, coronavirus.baltimorecity.gov.
Thanks, Doc. And I know one of the critical services that the health department has coordinated, and you had briefly mentioned, is testing throughout the city. I know every Monday you all put out a schedule, and I think there's probably 8 or 10 different locations throughout the city. Can you talk a little bit more about that partnership and how you were able to bring free testing to the city?
Yeah, so I mean, I think like you mentioned, we work with our partners, so we could not do this work alone. I have to keep reiterating that, Hopkins has been very gracious in taking over one of our mobile testing sites in 21224 so that we can establish another mobile testing site in 21224. We're also working with what's called a federally qualified health center, Baltimore Medical System, as well in 21224, and they're doing mobile testing in that site as well. So that partnership, again, all of those things have been instrumental in getting us to be able to do more testing throughout the city. The Convention Center is another testing site, and that's supported by Hopkins, Maryland, and Maryland Department of Health. I mentioned Pimlico, which is supported by the Maryland Department of Health. And then again, on the west side, the University of Maryland has established mobile testing sites. But you can see, if you look on our website, those locations every week, they change based on what the data is telling us, where the need is, as well as community-based partners that we have that can support additional testing.
And Doc, where can we find information on where to get a test if you need one?
Coronavirus.baltimorecity.gov. And there's a little link on the sidebar of where to get tested.
I'm going to ask you that URL probably 7 or 8 more times.
Actually, you know what? My communications director just posted it in the box for everyone to click on.
And I will ask Adam to post it a few more times too. It wouldn't be an episode of Downtown Download with Shalonda and I if we didn't go off script. Normally we save our questions from the audience until the end, but we have a very important question from the 8-year-old son of a wonderful friend to us at Downtown Partnership, Dion Joyner-Weems. So I'm going to go over to Shalonda real quick to ask this question.
All right, so should I do it in my Dion voice? No, I'm just kidding. It says, my 8-year-old son would like to know how close we are to a cure. I know you don't have the answer, but he is really pressuring me to send this through. God bless you all. #MyBeMore. Hashtag proudly Baltimore, right?
That's a really good question. So, COVID is one of those things. It's actually a virus. And if you know anything, or if you know a little bit about viruses, we really don't have cure to many viruses. Now, if it's a bacterial infection, we can also often give antibiotics, and that will be the cure. But viruses are a little bit different because of how they replicate in our body. So we don't typically have cures for viruses. What usually happens is that someone has to have what's called supportive care. So that's all that rest, drinking plenty of fluids, taking, Tylenol or Motrin for their fever, and the virus has to run its course. So I don't know that we'll have a cure, but what we are looking forward to is a COVID-19 vaccine. And so what we do see with vaccines are not necessarily cure, but they can stop you from transmitting or from catching COVID-19. So not sure that we'll have a cure, but at least in the next few months, we are certainly optimistic to have a vaccine that we can give to folks.
Thanks, Doc. I'm going to share the coronavirus dashboard. Usually we don't do this, but this is such an incredible tool. Shalonda, can we see that?
Yes.
Mm-hmm.
Doc, if we could go through some of the reopening indicators, and if you could walk us through each of these 5 reopening indicators and why these are so important to keep track of.
Yeah, so a lot of this we developed based on guidance from the CDC. So the CDC back in May, when we first released our initial dashboard, they also had a set of metrics and criteria that they were looking at. And specifically, it was around new case identification within a community, as well as number of deaths within a community. So as you can see, our dashboard indicates that we have not seen a decline in new cases, where our goal would be to see that decline over a 14-day period. And we have not yet seen that. We do see and we don't have to switch to this tab yet, but we've seen a slight decline in the number of new cases in the past just few days. But certainly we want to see this sustained decline in the number of new cases over a 14-day period as we think about transitioning from phase to phase. Additionally, the number of deaths, we did at one point see a peak, but it's remained relatively steady. So in the city, we're losing, unfortunately, about 1 to 3 people a day to COVID. So again, something that we want to be mindful of is just how fatal this disease is, and that it really is impacting people and taking people's lives. We also look at test positivity rate, and our current threshold is sitting at 10%. Now, recently the CDC has released guidance around setting a goal of 5% positivity rate. I think positivity rate is typically one of those indicators of how widespread the disease may be. So ideally, you're testing and doing a ton of testing so that you're getting less and less people who are positive. And the other thing that we look at is tests administered. So kind of segueing into the test piece, we want there to be a lot of capacity for testing. We're still not necessarily at the point where I think that it's on demand or it's as rapid fire as we want it to be, but we've certainly come a long way from when we first began testing in the city. So to see that number of almost 3,400 tests per day is huge. And it has been probably doubled in the past, I would say 6 to 8 weeks that number's doubled. And then lastly, we look at ICU and acute care hospitalization. So again, part of what we worry about is that hospital surge, and our hospitals being so overwhelmed that they can't provide the utmost quality of care to individuals who are coming in for treatment. We have 11 hospitals, acute care hospitals in the Baltimore jurisdiction, which is more than any other jurisdiction in the state of Maryland. We also have these world-class medical institutions that attract individuals from all over the state, let alone all over the country and the world. And so our hospitals tend to have a slightly higher utilization rate than others. And so when we established this criteria, we certainly took that into account. But again, we also have weekly meetings with our hospital partners where we can have discussions on where they are. Are they currently feeling overwhelmed? Have they had to reopen COVID units? Now that elective procedures have resumed, again, how is that affecting utilization? Do they have staffing? Are they experiencing significant absenteeism with staffing that would impact their ability to serve residents? So all of those things, some of them are on the dashboard and some of them are certainly the meetings that we have with our hospital partners partners to understand their capacity and what their needs are, and all those things influence our decisioning.
Thanks, Doc. And I know there's just a ton of great information on this dashboard. And if we left you to your own devices, you could probably talk about the dashboard for an entire hour. But while we have it up, is there one or two other things of interest that you'd like us to hit on in these tabs right here that would be of interest to our audience?
Well, let's look at the overview tab, because I think that's always a great place to start. And I want to explain maybe a few things on the overview tab. So if you look at that very first gray graph, so that's what we call an epi curve. So this is the data. This indicates the cases over the course of the day. And so we look at a 1 week average to try to average out again, we might have a day where we hit 150 cases and the next day it's 50. And so that's why we want to kind of average things out. We did see a peak in early August. We hit about 157. And so like I had mentioned before, we are seeing a slight decline in the number of average cases per day. As well, when you look at that last section of the bar graph, you can see that it's a little bit grayed out. We tend to have our data lag by about a week. And so we know that there can also sometimes be a delay in turnaround time for results. And so we don't necessarily finalize our data on this graph until a week out. Now, internally, we're able to see the new cases coming in every single day. So I get a report from my epidemiologist every single day indicating new cases that have been added. But it may not show up on here until a week later, just because we want that data to be final. And so again, we sometimes are still getting inconclusive results that come back in 2 or 3 days that are positive. And so our data does tend to lag for a week. And I just wanted to make sure that folks knew that was why the data lagged for a week. Not that we didn't have it, but that we know that we're still getting data in. So, the next bar graph, the blue one, again, that's looking at our death data. And again, we like to keep that 1 week lag, knowing that sometimes there's a delay in reporting. But we've stayed relatively stable for that information as well. So our death data, again, we've ranged from about 1 to 3 deaths per day. But I always like to start with the overview tab for anyone who's never gone to our dashboard, just to kind of get a feel for the data.
Thanks, Doc. Let's get back to some of our questions. That was really helpful. I probably spend a good 10 or 15 minutes a day on that dashboard playing around and just trying to break it. So, so where do you think we go from here? How long, for example, would you consider social distancing to be necessary? What about masks? And what's your take on the viability of this fast track vaccine that we were talking about earlier?
Lots of good questions. So, I think to start with, where do we go from here? I think that we are adjusting to the new normal. Here we are doing downtown download on from home, some of us. And so I want to commend every business that's somewhat, adjusted and figured out this new normal of how we can protect ourselves and protect others from illness. And masks are going to be a big part of that. And so, certainly as we think about reopening and being able to go out, the importance of wearing a mask, the importance of continuing to socially distance. So socially distancing being that gold standard, but in the event that you can't, always having your mask on over your nose and your mouth is going to be the next most important thing. And I think we're going to be doing this for a while until we can see, widespread dissemination of the vaccine. So even once we get the vaccine, say we were to get a vaccine by the end of this year, we also need to ensure pretty widespread vaccination of a good portion of our population. And we would likely start with those that are most vulnerable once we get that initial supply. And whereas in other, emergencies, maybe it's just typically affecting one region, so you can call on other regions for resources. This is a national emergency. And so nationally, we'll have to work to vaccinate those that are most vulnerable. And that also will take planning and dissemination, and already health departments are starting to think about what does that look like, right? Like we figured out the testing thing, we're figuring out mobile testing. How do we make sure that we can also then, once the vaccine is available, get it to the people who need it most first? and then subsequently continue to vaccinate others as well, so that we can get the majority of the population vaccinated. So I think we've got a little while, at least multiple months, if not, a year or so, before we can fully transition back to normal.
So I'm really curious if, let's say, we get a vaccination and it's tested and it works, how do we, how does the country go about mass producing something like that where we've got to churn out, 200 or 300 million of these vaccinations? How long does that actually take? Is that possible?
It's possible. I mean, I think it would be similar to the testing, right? And so again, I think it took us a while, I think, to get to a point where we had test kits and we had enough supply. And so I would hope that we would take lessons learned from some of the challenges we had with producing tests and swabs, and be prepared for COVID vaccination. But we do it annually with flu. Right. So with flu, we're certainly mass producing, vaccines, and there's a couple different vendors who do it mass. So it certainly can be done and has been done. I want to make sure that we're planning appropriately.
So we no longer have the issues that we had at the beginning of the pandemic with respect to testing availability, right?
It's better. I won't say no longer, because I don't know if you remember, maybe a few weeks ago, there was a slight lag in turnaround time. And some of that was because we were seeing spikes in the South and the West. And so some of the larger lab vendors were just getting overwhelmed with the number of specimens they were receiving. So, I mean, I think there's still, it's nowhere near like it was in the beginning. But again, I wouldn't say that everything is free flowing either. I think one of the challenges that we now face is also making sure that we have adequate staffing support, so that if we, test 1,000 people in a day, that we have enough staff that can call those individuals back and provide them with the care support that they need, as well as ensure appropriate contact tracing for anyone who's positive.
So speaking of testing, Doc, who should get tested? How frequently should they get tested?
Oh, that's a really good question too. So, I think that, what I will say is there's a misconception that I think that you just need to test everyone. And I don't necessarily know that we need to test everyone. I think that, again, going back to what I mentioned about us not having, a free-flowing capacity of tests, but certainly having a lot more, I would certainly focus it if you're symptomatic. And part of getting tested is because if you're symptomatic, or if you've been exposed to someone who's positive, you need to know so that you can isolate or quarantine, if you haven't yet developed symptoms, away from others and not infect others. So those are the two scenarios where you absolutely should get tested. If you've been exposed, if you're symptomatic. If you have a known exposure. If you have been generally safe, if you're staying at home, if you're abiding by social distancing, then I wouldn't advise getting a test just to get a test. I would really, again, focus it on people who are symptomatic, even if mildly symptomatic, because we just don't want to risk spreading, or if you've had that positive contact or exposure.
Thanks, Doc. And we know there's a ton of information out there on COVID-19, and there's also a lot of misinformation out there, unfortunately. What would you say if you had to pick one, and I'm sure there's probably a dozen, but if you had to pick one, what's the biggest misconception about COVID-19 that gets under your skin and really frustrates your team at the health department that you could correct right away if you could?
I think one misconception is that that somehow the pandemic has gone away, or is going away. Like I said, I think we're in a new normal, right? I think, I get not wanting to restrict your movements, not wanting to miss out on time with family and friends. I completely understand. I can completely relate. But I think we all have to be cognizant that at least right now we're in a new normal where spending time with family means, keeping your mask on. It means maybe not hugging when you normally would hug. And all of these things are very hard, and they don't feel normal. And so I think that's one of the things that, I find myself challenged by, and I know others are too. So maybe this misconception that, things have just returned to normal and the pandemic has gone away. That's one that I struggle with.
I know there's just a ton of misinformation out there, so that's really helpful, and I think it's important that people keep that at the forefront. Um, as you know, in downtown Baltimore, we have a large business community. What would you recommend business owners do to reduce the chance of disease transmission within their establishments? And is there guidance out there that's evolving as we learn more about the characteristics of airborne particles and surface contamination and things like that?
Yeah. Well, first, I want to thank every business that is doing everything that they can, because I know, a lot of businesses have planned and they've had thorough planning of how they want to enforce social distancing, of how they'll encourage their patrons and their staff to wear masks, providing appropriate cleaning supplies for their staff, cleaning in between patrons or guests. So I want to commend every business out there that has really worked to do that. In doing that, you might actually be saving folks' lives. So I definitely appreciate that. I think planning. So, when we started our response, what we did is we looked to our continuity of operations plan. So we went back to our COOP plan and we set up an incident command structure. So really having this very tight organizational structure to ensure appropriate flow of communication and collaboration as we work together on a single response. And I think that's been huge for our work. So having that COOP plan, or that kind of that backup plan, and thinking about what do I do in the event of, for instance, I have an absenteeism rate of 20%. What do I do in the event of, my supply chain is completely disrupted because I get, supplies from, this part of the country, which has recently been impacted. So there's that piece of it. I think the other thing that I would really, encourage employers and businesses to do is to push the messaging of wearing the face mask, of the social distancing, again, encouraging that as much as possible for people who come into your location, and just stressing the importance of that. That's what helps us reopen things. The more that people can abide by this guidance, the less cases we'll see, and the easier it will be to reopen. And then I think lastly, and I plead maybe on behalf of those that work for local businesses, really being very clear about what your safe and your sick leave policies are, and encouraging individuals who are ill, who have been tested, to stay home, and not being punitive in any way, right? So certainly what we've seen and what we hear through our contact tracing is individuals continue to go to work even when they're not feeling well, maybe because they're nervous about potentially losing a job, or not getting their safe and sick leave, or whatever causes them anxiety. They still feel compelled to go to work, and for some situations that's a culture shift. I've even seen it in local government. It's a culture shift to have people teleworking, right? But knowing that's crucial for us to be a part of this response. So I think just thinking through ways that companies can shift their culture to encourage employees who are sick to stay home.
Thank you. And Doc, before I'm going to transition it over to Shalonda in a minute. We've got a ton of questions from our audience. I do want to point out that you are our biggest sell as a special guest on Downtown Download. So we really appreciate you being here. Is there anything specific that a downtown partnership can do or the business community downtown to continue to support the city's response to the pandemic? Anything else that you can think of?
I think, again, it's the social distancing, encouraging that in your facilities as much as possible, and the wearing of face masks. And again, I want to thank, the local businesses that are, putting those measures in place. I know it's hard, if you have a patron or a guest who's not abiding by those rules. It is hard to know what to do or how to respond if you feel like this is a person that you're serving. But it's so crucial, I think, again, for us to be able to reopen, that we keep encouraging all of our patrons, encouraging everyone to kind of just take responsibility for themselves in this instance.
Thank you so much, Dr. D. Shalonda, over to you for some questions from the audience.
Absolutely. Thank you, Councilman. Dr. DeRaza, many of the questions you've answered, and so I'm going to skip through some of them. But one is a nice transition piece when you talk about wearing the masks and wearing it properly. I know a number of people wear it under their nose.
Mhm.
In there. And so one of our questions is, just on any advice to politely tell somebody to cover their nose with their mask or to pull it up. And are you guys doing any, I know you did a lot of marketing and advertising around that, anything to support that?
Yeah, and we probably have some flyers that we've given to local businesses on appropriate wearing of masks. I know I did a PSA around how to appropriately wear masks, so we're happy to share that with this group as well. But again, I know it can be tough. I mean, even me as the health commissioner, I usually will joke about it. That's the way that I typically will bring it up to folks, just to make the mood a bit more light. But just to stress, how important it is, right? Like you could be saving a life just by pulling it up, 2 inches. So, I know it is not easy, and you don't want to feel like you're impinging on someone's rights. But it's so important to protect yourself and to protect others.
Absolutely. Thank you. Going back to the regulations for the city's order, and this is specific, the question is really around the dining. Is the stop time still 10 p.m.?
Yes. Yep.
And that's indoor, not outdoor.
Yep. Not outdoor. Yep.
Okay. Just clarification on that from one of our attendees. And one other thing that Dr. Deraz, I know we got it separately as a question. I think it's worth you having the conversation, and I appreciate you had it with me. I shared it with many of the restaurants. In terms of special events, there's a limit to the capacity of 25 people max, regardless of size, regardless of indoor, outdoor. And the reason around that, and I think that's what I think needs to be shared so that people understand it's not just about the venue size, but the ability of how it spreads. Can you elaborate on that?
Absolutely. So, again, going back to some of what we learned from contact tracing, and contact tracing is one of those things where, we're really trying to determine where a person may have come in contact with someone who had COVID-19 and originally was infected with the disease. Some of what we're seeing is that people are going to large events, parties, or graduation parties, cookouts, that type of thing, and because you're with your family or you're with people that you're comfortable with, you're much more inclined to let your guard down than say you walk into another location. You're much more inclined because this is your family, these are people that you trust, and so the gatherings was really focused on how do we reduce potential exposure if there are these large events, again, and it's people that I trust, or sometimes maybe it's people I don't trust or know, but it's a party, so I'm far more comfortable. I'm going to take my mask off, I'm going to let my guard down a bit, and not be cognizant of the need to socially distance or keep my mask on. And so that was why we focused on gatherings in particular, as which we knew was contributing to some of the transmission.
Which is helpful. Thank you so much. Question about whether or not you can get it twice. So if you've already had it, can you get it again?
And I'll say we're still learning a lot about it. Right after an infection, there's typically a period of immunity, which we think lasts maybe a couple of weeks, but it's not indefinite. And so certainly, you could have had it in March and certainly could be subject to get it again in August. But again, right after, once you first had it, there is a period of immunity where your body has typically built up antibodies and you won't get it again. And so you're actually safe, to return to work, for example. But again, a few months later, you certainly could get it.
Okay, thank you. Going back to the testing, do you know what is the accuracy rate of the COVID-19 rapid testing?
So the rapid testing has a slightly lower accuracy than the nasal swabs and the oropharyngeal swabs that we're doing. I think it's about 85 to 87%, where the nasal swabs are upwards of 95%. And so those are currently preferred, but certainly rapid testing, if you need to know immediately, it's not bad. It's just not as accurate as your nose or your mouth swab.
And if we stay there with the city, so the city does which type? They do the nasal testing?
Yeah, we aren't doing rapid testing yet.
Okay, and then how are our testing locations doing in terms of turnaround time now? I know you mentioned
Yeah.
earlier there was a little bit of a lag.
It's on average about 2 to 5 days. So it's, and we've seen that come down in the past few weeks. So really closer to 2 to 3 days. But I would say in mid-July when we were at our peak, it was around closer to 5 days.
Okay. And then I'm going to stay on testing just because we're there. I'm kind of going through the questions. Could you please go over free public testing and not free private testing? Navigating
Sure.
options can be a bit confusing.
So that probably the easiest thing to do, and I don't know if I guess I could even share my screen, would be to go to our website, because on our website we have listed where folks can go. So I would say if you go to our website, I'm going to try to share my screen here. And if you scroll down past the dashboard, I'll see. Let's see if I can share. Doesn't look like am I able to share? Here we go. All right.
I got you, Doc.
There. Okay, perfect. If you click on where to get tested.
So we got the dashboard up here.
Yep.
You're going to scroll down. And we got a little button here with an exclamation point that says where to get tested for COVID-19. I'm going to click on that.
Yeah. So the map is a mix of public and private testing, I guess is how people might be referring to it. But if you keep scrolling down, then you'll be able to see the actual locations for that week as well as the days. So Pimlico is again our high throughput test site. Appointment is not required, but it's certainly recommended, and it's something that you can make online. Again, it's a free appointment, but still nice to have that appointment so we can plan accordingly. And then down here is our mobile testing sites. So these are first come, first serve, no appointment necessary, walk-up testing sites. And again, they tend to vary week to week depending on partner availability. And so, I would recommend anyone who's looking on where to get a test, this would be the place to go.
Okay. Perfect. Thank you so much for sharing. Councilman, I think this one may be for you in terms of the amount of time it's taking for businesses to get outdoor dining permits.
Sure. So that's something that Shalonda, you and I worked on together as co-chairs of the Mayor's Small Business Recovery Task Force. There's 3 different components to that. There's the outdoor seating relief program. There's the outdoor dining street closure program. And then there's design for distancing. So the outdoor seating relief program is a program we put in place to allow restaurants to expand existing outdoor seating on the sidewalk to a larger portion of the sidewalk, or to get new outdoor seating on the sidewalk if they previously didn't have any. We've cut that approval period down from about 3 months to 3 days. Then we have the outdoor dining street closure program. That allows for restaurants to have outdoor seating and a parking lane closure in front of their establishment. And that approval period takes about 7 days. And then our third component is the design for distancing, which is being run out of Baltimore Development Corporation. That's a little bit longer of a process that's being utilized in Main Street areas throughout the city. For example, in the 11th District, we have that in Federal Hill, Market Center, Mount Vernon, as well as Pennsylvania Avenue. So that's where the Main Street program, or the RBDL, essentially a business association for the area, works together with different stakeholders, community leaders, et cetera, city agencies, and comes up with a comprehensive plan for the entire area. The neighborhoods selected for that were pre-selected by BDC. But the long story short is that we feel like we've created a very robust set of programs that is equitable, and that we have ensured that every single restaurant in Baltimore City, in one way, shape, or form, can get additional outdoor seating to supplement their revenue and hopefully put them in a better position to be successful. If there are specific restaurants that you're referring to that may have an application in the hopper, I will put my email address in the chat function. Please feel free to email me, and I will make sure that we get that application expedited and approved as quickly as possible. And I would point out that the city is treating these as a matter of right. Mayor Young was very specific that we weren't going to pick winners and losers here, that we needed to give every single restaurant in our city a chance to be successful. So as long as the proposal is not ridiculous, for example, we're not going to let Fogo de Chao shut down 5 lanes of Pratt Street, but we certainly will let them go out onto the sidewalk on Pratt Street. As long as the proposal is reasonable, it should be approved.
Sounds good. Thanks, Councilman. Going back to you, Dr. DeRaza, early on in the crisis, there was messaging around staying home except for essential needs and services in there, but those who had to continue going to work. Should we continue to do this? And if so, how do we support businesses that depend heavily on foot traffic?
Yeah, I think that I would say that I still recommend staying home when possible, and really, I think keeping in mind that if you do go out, that there's always going to be an assumed risk. Like that is, I think, just the reality again of kind of this new normal. That anytime you go out and could potentially interact with other people not in your household that are also out and about, that there is a risk. And so I think that the focus is on how do I reduce that risk in instances where I do have to go out. And for instance, if we're thinking about local businesses, something that I've done is I've tried to order from local restaurants that I love. So I love eating out, but have really focused on, okay, picking a few restaurants that I love and order from there every week. So I'm also looking at the COVID-15 right now, but really ordering from those places every week. As well as, again, picking out activities that are going to be more safe. So taking my son outdoors to the park is something that I feel comfortable with. We bring our own equipment. We're not necessarily getting on playground equipment that's shared. And he's 3, but he'll wear his mask too when we go out. So again, I think it's all about thinking through what are the risks of potentially going out, because anytime we kind of go out, that there is that risk. But I strongly encourage, certainly, in supporting your local businesses by ordering online. By doing a lot of businesses I know have the contactless pickup where you can even pick up things. So I would encourage that.
Sounds good. Thank you. Does it apply in our area if you travel to North Carolina or another state where they're spiking that you need to quarantine, or is that just a personal preference?
So I know the governor has recently released information on, depending on what the state is, that you should get tested and quarantine. And I don't know off the top of my head if North Carolina is on that list. So I'd have to look that up. I mean, I think again, anytime we go out, there is a risk. And so being cognizant of what that risk is.
No, thank you so much. And then Councilman, I know I'll go back to you right here, and this you may or may not know, we may have to get back to this one. Is anyone aware of how the city court system is handling trial cases during the pandemic? Are those being done virtually? If you know, Councilman, I'm not sure. You don't? Okay.
No, I don't. I know courts were closed down for a couple months. I'm not sure if they've transitioned to online or not.
So for our team,
they're mixed. Yeah, so they're mixed. So they have not resumed any jury trials as of now, and they have begun to bring some people in, and that started, I believe, on July 24th, if I'm not mistaken. But you can go to the Circuit Court's website to know which cases they're bringing back. So they have a whole phased approach on how they would like to begin bringing court cases back in.
Sounds good, thank you. There's one that really falls in our area in Downtown Partnership, Councilman. It's addressed to the city as well, but it's really talking about holistically as we start to think about the winter months. Our outdoor dining initiatives have worked in the summer, but as we prepare for the winter, what are our thoughts overall? I know we've been talking about doing some things with tents and heaters to support some of the businesses as well. I know that it's on our plans for having to make accommodation and figuring out how we do that. Anything else that either of you have been working on, thinking, know about?
I'm going to jump back to something that Dr. Jiraza said earlier. everyone's got to wear a mask and everyone's got to follow social distancing if we want to get out of this thing. And again, I'm not a doctor, so I'll defer to the doctor for the medical
You're
advice.
hoping it's over by then? No.
But this is something that I know myself, Shalonda, I know you in Downtown Partnership, our team there, everyone has been preaching, you've got to wear a mask when you're out in public and you've got to practice social distancing. But I'll turn it over to the doctor for the real medical advice.
No, I mean, I think you put it perfectly. I mean, I think their question was, it sounds like around potential modifications, and so
Right.
certainly the heated tent sounds like an option. Fully recognizing one of the challenges that we will be facing in the fall is flu season concurrent with COVID-19. And so I will take this opportunity to encourage everyone to get their flu shot as well, just because the symptoms are so similar. And we also tend to see that surge again in the fall. And if you're going in for flu or COVID, it's we can't really distinguish between the two until we get those tests. But again, you're potentially adding additional folks in the hospital that could be starting to get overwhelmed anyway. And we just want you healthy. So please get your flu shots this year to decrease numbers. Some countries have actually shown that when people again implemented the social distancing and wearing face masks, you also saw decreased transmission of flu. And so I think that's also something to keep in mind, that flu is another infectious disease that is passed much in the same way as COVID. And so by doing the things that protect you against COVID, you're also going to be protected against flu and get your flu shot. So.
Yeah. Thank you. That was one of the questions. It was coming up next around the flu shot. A question from somebody on here as well. Do you have to be a city resident to get tested in the city?
You don't. Nope. So all of our testing sites, same thing, convention center, they're open. Again, the ones that we support, and we're not asking if you're a resident. So they are open.
All right, which is good. What can businesses, NGOs, and larger nonprofits do to support the health department during this time?
So I think that, one of the things that we love from those partners is that they're trusted voices in their communities. And so I think it's certainly important that we as, government officials, talk about social distancing and talk about wearing masks. But I think you guys are the ones that are on the ground. You're trusted employers, you're trusted leaders within the community. So I think if you're also sharing that same message, sharing information from our website, that is so helpful in amplifying our message.
Which is perfect. Thank you so much. Going down, just making sure we covered everything that's in there. This question is a little bit different. It says, is it going to be a live virus? I'm a transplant and my wife is a donor. Will that affect the virus?
So, and I think you're saying, is this going to be a live vaccine? I think is the question. And I believe there are different types. And so for instance, the flu has like a live attenuated version, and then they have another version that is safer for those that might have a compromised immune system. And I think they're working on both for COVID-19 as well. And so of course, if you have a compromised immune system, then we don't recommend the live vaccine, but there should be an alternative that would be safe.
Which is perfect. In here, Confetti, just want to make sure this question, how scared should we be about all of the predictions that Baltimore could be the next New York?
So, I think that this goes back to something that we've been saying throughout. There are certainly responsibilities that businesses have taken on to ensure social distancing, and there's certainly responsibilities that we at the government level are working to try to decrease transmission. But I think we all individually have a part that we can play too, in wearing our face coverings and maintaining that social distance. And I think the more we're able to do that, the more we're able to encourage the people around us to do that, the better off we'll be as a city. Again, I can't stress enough and highlight enough how important our partnerships have been in supporting the city's response. And the academic institutions have been fabulous. The hospitals have been fabulous, but we all also individually have different things that we can do. I do want to plug washing our hands too. So again, anything that we can do individually to decrease transmission, I think we all have a role to play in how this thing spreads or doesn't spread.
Sounds good. I know we're getting close to time. I'm going to do one more question, and then Councilman, I'll come back to you just for some final comments before Dr. Darasa. You can say something and we'll start to close it out in there. And this is just, the person is asking, you mentioned the flu shot. Do you know, or do we have locations where people can get the flu shot?
So I would always say if you have a primary care provider, try to start with your primary care provider first. Typically, they'll be available in September, maybe as early as the end of August, depending. So start by calling your primary care provider if you have one. In the event that you don't have one, I know a lot of hospitals and even the health department, we're looking to develop a strategy that would allow for access for people without health care or health insurance. To make sure that they're covered, again, with a particular focus on those that are most vulnerable, our older adults or those with underlying health conditions. But certainly start with your healthcare provider. Another great resource are pharmacies. So now I know sometimes it's hard to get into your healthcare provider, but CVS, like a lot of the Walgreens, a lot of our pharmacies will also provide them at either a low rate or they'll give you a discount if you purchase something in the store. So I would say start with your healthcare provider. If that's not available, think about your pharmacy. If that's not available, then relatively soon the health department will be providing updated information on where individuals can get flu shots.
Which is perfect. Thank you so much, Councilman. Let me come back to you for some final words.
Thanks, Shalonda. Dr. Jaraza, thank you so much for everything that you're doing and that the health department's doing. And of course, thanks for taking an hour out of your busy schedule for us here at Downtown Partnership. We really appreciate it.
Yeah, thank you guys for having me.
Sounds good. I want to thank you again. I also want to let you guys know what's coming next. Dr. Raza, as Councilman talked about, you were one of the favorites in terms of turnout. So I thank you for that. Coming up next, we do have, next Tuesday, we have the president of the Baltimore Ravens, Dick Cass, who will be with us. And so we ask that you all continue to tune in. Want to remind you that you can get this webinar, among others, on our website, which is godowntownbaltimore.com. Please consider following our social handles. We're on Facebook, Twitter, Instagram, all of that. So please continue to check in. We want to give not only this type of information, but information on our restaurants, our businesses, our resident activations. We're here for you. So I want to thank everybody for attending today. Special shout out to my team. I know Mike Evans and Nicole Rohr have been really working hard to make it happen. Always have to shout out my board chair, Mark Wasserman. So thank you all for tuning in. Dr. Daraza, special shout out to you and Mayor Young just for continuing to help keep us safe here in Baltimore. Have a good time, everybody. Thank you.